Plastic Surgery Talk. Brought to you by Mentor, maker of memory gel breast implants.
Welcome back, and before we wrap up today, we're going to take a question emailed to us at theplasticsurgerychannel.com from one of our viewers. This is from Holly, who's actually overseas in Athens, Greece, who writes, "Why do some patients who have breast reduction surgery end up with dead tissue and really awful wounds? How can you prevent that? Is it the doctor's fault? If the operation goes great and the patient follows the post-operative routine correctly, can it still happen? Please tell me because I'm really, really worried." Caroline, I know there's a lot of questions in that question, but can you tackle that one for us?
Yeah, I mean, a breast reduction surgery has its risks and its benefits, what we sometimes refer to as trade-offs. You are going to be able to reduce the volume of the breast, but there's significant scarring that occurs even if it heals beautifully. Of course, you have to look at some patients have a higher risk of scarring, skin types, skin color, and as well as underlying illnesses such as diabetes. Cigarette smoking is one of the leading causes of wound problems that a doctor should address with the patient before they undergo surgery. But it is surgery that involves a lot of sewing, a lot of wound healing, and one of the things that we usually let patients know is it takes quite a bit of time to heal from those wounds, and that the scar will get better over time. It's an old expression that we call tincture of time. Wounds do get better over time. So unless there's an unusual complication, the benefits of having a smaller breast size comes with that trade-off of some scarring.
And wouldn't you agree, the breast reduction patients are incredibly happy because their symptoms are so much vastly improved with the surgery?
Yeah, I'd say 99% of patients that I see, or that's a good percentage of the patients, are so happy with the results of a breast reduction. And like I said, it takes time for the scars to mature and soften, and without any unusual complications, I think the benefits are very rewarding to the patients.
Yeah, and I think you covered the risks of that very well. For our viewer, Holly, those things can occur, but routinely they don't happen that often.
No, they don't happen that often.
And the truth is that the main thing from the patient's perspective, and we talk about this a lot on our show, is that they should also make sure they seek out a board-certified plastic surgeon.
Absolutely.
To do the breast reduction. Would you not agree?
Right, a board-certified plastic surgeon. You want to have it done at a licensed facility with board-certified anesthesiologists. All of that plays a part in the entire surgical procedure, as well as the recovery, good wound management, good instructions, when to return to normal activities. Patients can return to work too soon, return to lifting too soon, exercise, working out in the gym too soon. So a physician should give them a whole follow-up plan on how they would heal the best.
Well, Caroline, really appreciate you sharing all your insights with us today. I've learned a ton, and I'm sure our viewers did as well. So thank you very much for coming.
It's been great.
And thanks for joining us today on Plastic Surgery Talk. Coming up on our next show, we have a very exciting topic. We'll talk about tips and tricks to keep your eyes looking young and beautiful, both with surgery or without. Until then, make sure to email us at theplasticsurgerychannel.com or send us your tweets on Twitter. We'll see you next time.